Hello and welcome to Doctor Talk. My name is Roberto Pereira. I'm a cardiologist practicing in Jasper, Georgia. Before we get started, I just want to remind you that what we're going to be discussing today is for information only and does not replace the advice of a qualified licensed healthcare professional. Our guest today is Dr. Cathrine Rice, Director of the Emory Autism Center at Emory School of Medicine. Dr. Rice, welcome to the program.
Oh, thank you. Thank you for having me.
You have a very extensive and respectable CV. You used to work at the Center for Disease Control and Prevention, correct?
Correct, yes.
And at that time, were you involved with autism already?
I was. I really began working intensely with people with autism during the 1990s, working all over Georgia and seeing so much growth in our school systems and in our diagnostic clinic and in our school at the Emory Autism Center. And had the opportunity to work with the Centers for Disease Control when they had concerns about increases in the number of children identified with autism. So for the past 14 years, I've been working focused on public health. How can we understand how many children have autism, how the diagnosis of autism is changing, and how we can improve early identification. And I really wanted to, recently had the opportunity to take that information back and think locally in Georgia again. You know, we're seeing those same increases in people identified, and we have a lot to do, and so shifting focus a bit back more to what we can do here in the state.
So you're now at Emory, and there are two major autism centers here in Atlanta, or Atlanta metropolitan region. Could you tell us about that?
Right, so the Emory Autism Center, where I am, we're a relatively smaller center, but we do work with folks across the state, from toddlers up through whatever age, through adulthood and as in older age as well. We are more of a service center in that we have a school on site, the Walden Early Childhood Programs. We work within public school systems across the state. We also work with adults with autism in terms of learning and practicing life skills on the Emory campus and through our health and medication clinics as well. So that's the Emory Autism Center. There's also the Marcus Autism Center that is part of the Children's Health Care of Atlanta, affiliated with Emory Pediatrics. They are a much larger center in terms of research. They are really pioneering a great deal of research on the early identification of autism, working with children, and we work together very closely in trying to improve early intervention and identification of autism around the state of Georgia. We work with them to transition a lot of the kids they see to adult health care as well.
So you mentioned the increase in the incidence of autism. Mm-hmm. Was this an increase on the awareness or changing the diagnostic criteria for autism, or really more people are having autism now? How would you say?
Yeah, as I mentioned, I really got involved with the Centers for Disease Control because of the concerns about more students with autism being identified in school systems. Communities were noticing that more individuals were being identified with autism. And since that time, we've really tried to look into, well, what's going on here? And we know that we've had a massive sea change in terms of how we understand and how we see autism, and that we see it as a much wider spectrum. And so there are more people identified with autism today than in the past, but it seems like a lot of the reason for that is because we've sort of widened our lens, that our view of autism has gone from the more severe presentation of the condition to a much wider spectrum. Individuals that may not be quite as impaired or may have some really positive skills, as many or most people with autism do across the spectrum, but we really see autism in a much broader way than we did before.
So it's more that you were missing people with the diagnosis before. It's not that more people are having, like people that you maybe 10 or 20 years ago you would not have recognized had traces of that would fall within the spectrum, correct?
Yeah, I think that's certainly a big part of it. I mean, I look back to folks I went to high school or college with, and now, oh wow, that person is really a classically Asperger's profile of having autism, but at the time, They were just seen as very quirky, somewhat brilliant, kind of odd. People didn't quite know how to interact, but they were smarter in terms of the academics in many subjects, and people just said, well, that's just who that person is. And there's some benefit to that. I think a challenge is that a lot of individuals like that went on and are now struggling as adults because they didn't have the specialized intervention they needed to really help navigate the social world, to navigate the independence required as an adult. So we know some of that, not only on the more mild end, but also on the end where individuals may have more extreme intellectual impairment. We're recognizing signs of autism and the package of autism across the spectrum more. And so again, I think that is a great deal of our change in our numbers of autism, and the fact that our awareness has evolved. Not just that we were missing it, but we saw autism in a different way in the past. Autism was once considered a form of schizophrenia. Now we know they're very different conditions. We know autism is a developmental disorder, that the brain is functioning different, probably starting from before birth, and the early signs come out in the second year. That's a lot of our evolving understanding of autism. At the same time, there is a likelihood that there's also some increase in risk. That's probably not the majority of individuals, and it's hard to parse out how did someone get autism, because there's multiple causes. But we've had major changes too in our basic biologic functioning. We're able to keep babies alive that maybe were born too small or born very early, and those kids are likely to have developmental challenges. And so a positive thing is that those little guys and girls are here. A challenge with that is that they may have additional challenges that we weren't seeing in the population before because they might not have been alive in the past.
So just as a broad definition, how would be like no autism or no person is typical? There's not such a thing as typical as a typical person. Like everybody's an individual, and if it applies to me and you, applies to autistic children. But there are things that would characterize people that are within that spectrum. Mm-hmm. Could you just give us some generalities, and please don't try to do this at home. You do not diagnose autism on your own. If you think that there's somebody with autism, ask Dr. Rice.
Okay.
Okay, but
yeah, I think autism, in some ways, it's a label, like most diagnoses. It is a way of describing a behavioral profile, the way development is unfolding in a certain pattern for an individual. So the core feature of autism is challenges in social interaction and communication, and that can be the whole gamut from really not seeming aware of other people, to being aware but kind of much more targeted focus on different objects or things that person's interested in, to somebody that's very interested in interacting, but they just don't have the social insight, kind of like a social learning disability, where they just don't see how to think like other people are thinking or how to take other people's perspectives. So that social communication interaction piece is a huge core part of what is autism. And autism can occur across the whole range of communication abilities. There are some people that don't have verbal language. There are some people that have some verbal language, but maybe they repeat what others say. There are some people that have excellent full sentences, very complicated. But what's in common is that whatever level of communication you have is using it to connect with and communicate with other people is a challenge. So whether it's a basic, I'm going to just show you this toy, Mom, because I want you to see it, a child with autism might not do that, or they might not point to something just to show it to you or to use their gestures. Somebody that's much more conversational may not pay attention to the cues from the other person, that they're not paying attention, that they're not interested, and may just have kind of a monologue. So it's that ability to use that level of communication in a socially appropriate way that's a challenge of autism. And there's more to it. Mm-hmm. And so I can tell you a little more.
How good are they into handling small talk?
Small talk is usually not
doesn't work.
Doesn't work too well. I mean, I think for many of us it's a challenge, is the chit-chat talk. But But most people know that it's kind of a social rule or a mores that we follow, that we, hey, how are you? I'm fine. You know, and you hear the joke that nobody wants you to really, when you say, hey, how are you, go, oh, I had such a terrible day, you know, whoa, stop it. You know, we have these, just these understandings about how we have niceties and how we interact, and depending on who you're interacting with, is it just someone you're passing, an acquaintance, versus a really close friend who you might
really want to know how they are.
Exactly. So it's judging those type of things that it's often something we do implicitly, that most individuals are really, we are biologically driven to understand and impute intentions, and to look at the situation in relation to other people, and then adjust our behavior. And that's really challenging for people with autism.
So, and they have also at times trouble with irony and sarcasm, understanding like the hidden meaning of a second message, right?
Yeah, I think both with the way many individuals with autism learn and process information is that it's much more observable, tangible information versus the things we have to infer, or the things that we have to take different perspectives into account and put it together. But many people with autism are much better than most people about learning information and facts, or making a connection between, I've seen this before and it matches what I've seen here. So there are some strengths as well that are unique and important also.
So they are pretty good at handling blocks of information, but if you have like a Play-Doh-like thing, like more soft, that you have to manipulate to find the shape, may be a challenge.
Maybe, yeah, maybe so. So, and then these are generalizations. Everybody is certainly different, but trying to, you know, say, well, what makes somebody have autism is really that core difference in awareness and understanding of how to interact and communicate with people. In addition to, another major area that helps us identify that somebody has autism is restricted and repetitive behaviors and interests. So these are the more classic things that people think about when they talk about autism. The child that's rocking, or the adult, or the person that's kind of flapping their fingers or looking at things very closely, lining things up. There tends to be a repetitive nature to what many people with autism do, both in the way they move their body or approach toys or things in their environment. And so that's another key feature that we look for when we're trying to determine, does somebody have this profile of an autism spectrum disorder.
Okay, very good. We're going to take a quick break now, and then we'll return to this very interesting conversation with Dr. Cathrine Rice.
Thank you.
We'll be right back. Hello, we're back. We're here talking on Dr. Talk with Dr. Cathrine Rice, Director of the Emory Autism Center at Emory School of Medicine. And we continue our very interesting conversation about autism. And we've covered lots of ground, but there's still much more to talk about. Well, how early can the autism be diagnosed?
I think we are getting better at diagnosing autism earlier and earlier, but pretty reliably around the age of 2, 18 to 24 months is when the first signs really become much more clear for autism. There are situations where we can identify that the pattern of autism is present earlier. We've seen kids as young as 14 months in our center. There are other research projects going on that are really looking hard for signs in the first year of life. But a really important thing that should be happening for all children is that as part of their child checkups, when they go to their pediatrician or the healthcare provider, at certain ages, particularly through infancy and toddlerhood, they should be getting developmental screening tools where the physician or the office staff gives the parent a checklist or asks very structured questions about how the child is communicating and interacting and learning and playing and moving. And those can really help us get some clues. And particularly at 18 and either 24 or 30 months, all children should be getting an autism screener. And with an autism screener, the parent is asked very specific questions about how the child is interacting and communicating and playing. And that can really be a good start to helping identify autism. If the parent has some concerns about the child not learning to use as many words as other kids, or doing unusual things with their toys, or not being interested in interacting, those are all going to be important signs that maybe we need to look a little bit further and do more evaluation for potential autism.
And what's the importance of making the diagnosis? Because can it change the development of the child? Can it give this child an advantage that he or she would have missed if they would try to raise this child without a special care that autism child requires?
Well, I think a key about, there's always a search for, is there some kind of medicine that will help? Is there some sort of technique that will help fundamentally improve functioning so that autism isn't present? And we don't really have that at this point. What we have is knowing that teaching needs to be much more intentional for children who have a pattern of autism. And the earlier we start that, the more their brain is still forming, the more we can help practice skills and help them to use words or to communicate, help you know what they're interested in, pay attention to other kids, learn how to take care of their toileting skills, or pay attention to more than just lining up their cars. I'm gonna learn how to pay attention to more things around me. So we have to practice and be intentional in really helping guide the child to practice those skills and learn those. So that's what's really key. The earlier we do that, the more opportunity we have to influence the child's developmental trajectory.
So that's very important that you mentioned the diagnosis. I spoke with a lady who has raised an autistic child in the 70s, and one of the things that she had at this time, the resources that she had, was the library. Mm-hmm. And the library book told her that, well, it was probably the mother's fault. Mm-hmm, mm-hmm. There used to be one concept.
Right.
Is it true?
No, I think a major disservice for many, many years was the perpetuation of this idea that autism was caused in some way by parenting. Even in the early 90s, when I went to the library to find information on autism, I still found this old book that talks about refrigerator mothers, and it was really, I can't imagine as a parent going to try and understand what's going on with your child and coming across this book that blames you, when we know absolutely that that is not the case. We know that autism is a fundamental difference in the way the brain is developing, the way the brain is structured, the way the connections are happening and not happening in the brain. The challenging thing is that there seems to be many, many potential causes for these variations of autism, and so it's really hard because we can't point to a physical difference, physically seeing it. We don't have a biologic test that helps us confirm. What we're really depending on is this pattern of development that unfolds in the first few years of life. But much research is connecting it back to differences in how the brain operates. So, we absolutely have gone beyond that, and hopefully no parent ever hears that autism could be caused by what they're doing. Your fault. That's a terrible tragedy of history. And thankfully, now we have many parents. Unfortunately, so much falls on them. They have to be the ringleader, they are the service coordinator. They are the ones that have to pull everything together. We have very challenging systems of care, if you can call it that, in our country and unfortunately in our state. I think there are things that are improving. But learning how to access help and find other people that have gone through this is really crucial. And I think the best source is often other parents. There are great organizations out there like Parent to Parent of Georgia that helps connect families who've gone down this road. And so there's a lot of hope in terms of what we can do today.
So eventually these children will grow. Mm-hmm, mm-hmm. And for every child that comes the teenage years, that is an explosion of emotions, mm-hmm. behavior change. And how does this transition, this milestone of becoming an adolescent, goes with autism.
Right. You know, people sometimes joke that just being a teenager should be a diagnosis in and of itself. It's a very challenging time for most. There's so much physical, mental, all kinds of changes happening in the body, and the same is true for people with autism. At the same time, you have the challenges in communicating or observing your peers and making that connection about how do you fit, how do you not fit. There may be increasing recognition that you're different than other people and how do you fit in. So some of those stresses and pressures may be increased. So you have the same range of biological and emotional challenges, but I think amplified for many individuals with autism because of the social and the communication challenges they have.
Yeah, and that really, we say, well, autism people don't socialize very well. Teenagers, at times they don't.
Right.
So it's not that every teenage boy or girl is autistic, but on top of that, you may have to align those developmental milestones with the things that happen with autism.
Right.
And talking about boys and girls, is there any increased prevalence in a gender versus the other?
Yeah, that's been one of the most common, consistent findings in terms of if you look at the population of who has autism. Now it's about 1.5% of the population having autism. There usually are about 4 boys to every girl. And that gives some clues in terms of maybe what's causing autism, but otherwise it's not really clear about what is going on. But pretty much, like I said, more boys are affected than girls.
And is there any particular tendency to have one or different form of autism in boys as compared to girls, or everything can happen in both?
There's some evidence that girls tend to have more associated conditions. They may have more intellectual disability than boys, or be more severely affected as a group. Now, there's some debate going on about that, is that we just don't recognize the signs of autism among those who may be more mildly affected, girls, that we kind of have a prototype of autism and we're kind of focused on more boy-type interests. Or there's also theories that it requires kind of a bigger combination, a bigger hit that creates the biologic processes that cause autism for a girl, that being a girl is protective somehow, if that makes sense.
Well, we're approaching the end of our program, and I'm going to get free advice from you.
Oh, boy.
Okay. So, you know, autism, like you said, is very prevalent, about 1% of the population. So quite likely today somebody, a young family, is getting this diagnosis, and they're overwhelmed by it. What would be your advice to these parents that are getting diagnosed with a child with autism at this time?
Well, I think, you know, we talked a lot about early diagnosis, but many people are still being identified across the lifespan. So I think that's an important point too, is that, you know, autism is a lifespan condition, and it's a long road. So the diagnosis, as challenging as that is to seek out, it is a process of trying to really come to grips and understand that this person sees the world, thinks and processes information in a fundamentally different way, but that often in a very unique and creative and interesting way, and that we have a lot to learn from those individuals. So I think the most important advice is to connect with other families, to try and remember to live your whole life, and to, you know, see that there are a lot of positive gains and wonderful things that can be done, as hard as it will be.
And these children can be happy?
Yes.
Okay.
Yeah.
Dr. Rice, thank you very much for coming to the program. I really appreciate how much you have shared with us. Thank you all for watching, and I'll see you next time on Dr. Talk. Thank you.
Thank you.